if there is good, authentic, or in some ways dynamic partnering, it does impact the science, it impacts the intervention, it impacts the research. If I'm, as an academic, creating something in my office, it's not going to be the same intervention than if I'm actually working with community partners who are bringing their cultural knowledge, their ways of thinking, their experiences, their history into this intervention, which can be then truly culturally centered. So one of the major outputs to me of working with honoring and respecting the knowledge in community is that the intervention and the research design itself is really grounded and centered within the community. So if you have community members participating in identifying the issue and identifying the ways of knowing the theories of etiology that are theirs of why this problem exists in that community, and then ways to think about change, that will impact the creation of the research question. It will impact then the creation of the sample of who they interview. It will impact the creation of the data instruments, and those then will hopefully they'll be involved all the way along. One of my pet beefs with a lot of community engagements is that it stops with just identifying the health issue, or it stops with just involving people in collecting data and not the analysis and not the interpretation and not the translation into policies or practices or programs. So that community involvement all the steps along the way is part of that integration of community in the research process, and that's in this intervention and research domain as well, with then an output being that the community experience is actually embedded in the research design.
My partnerships right now are with tribal colleges across the U.S., and they're very interested in what contributes to academic success of reservation-based kids. And one of the things that we know is their mental health status. So they're very invested in learning, what is the prevalence and correlates of resiliency and good health and high productivity and good outcomes. They want to know what are the, historical and family-related factors that contributed to good outcomes. And so they're, that's one way that we engage them. And they actually tell us, through that engagement, they tell us about their theories of etiology and theories of change about what contributes to good outcomes. Yeah, and I think what you alluded to in the beginning was something that's also inherent in Western science that is just now changing, and that is the universalizing of subjectivity. Thinking that there is one subjectivity defined by Western science that everyone needs to, at some level of progress, adapting to or assimilating to.
And if we take away a universalizing approach, then it really can be based in an empowerment process.
Oh, that's
because good. Empowerment is not what you give a person or a group. Empowerment is where people themselves claim their power.
Right.
And so if you as an academic, me as an academic, can come in and create safe spaces where people's knowledge is actually honored and respected, then people can claim their own power.
Exactly.
They have, that's built on the strength and resiliency of the community. So a CBPR process to me is really an empowerment process, which then leads to this incredible synergy of people working together towards the ultimate knowledge created together for the benefit of the community and the benefit of democracy, really.
Yeah, knowledge democracy. Yeah, I have one good example of that. I remember, one of the meetings that we were having with tribal college presidents, one of the presidents said, we are tired of being marginalized and victimized and, collecting data on how stupid or backwards or mentally ill we are. He said, this intervention, this survey, this approach needs to be based on our strength and our resilience, what's working so we can support that and water the seeds of that and have that spread more to all of the students and faculty and staff, not just to the ones who are actually succeeding. And they were really upfront about that, and it was the best advice we had gotten.